Hi, my name is Sandy. I'm a resident of Baltimore City. I like to cook. I'm a single mom of 3. I have my daughter here with me. Her name is Summer, and she's been my caregiver since 2022. I was diagnosed with heart failure and CKD at the same time. It was hard to breathe. It just felt like somebody hit me in my chest with a pole. I had a hard time sleeping because of the fluid building up. I had a hard time walking distances. I was in and out of the hospital a lot. When I had hospital stays because of the heart failure and the CKD, I would be in the hospital from a week to 2 weeks to maybe a month. It was hard because you have so many people doing so many things to you that it's really hard to keep up with it all.
I don't know who in their right state of mind would enjoy being in the hospital for 30 days. Is ridiculous. To me, that's not living. How can you live your life in the hospital? You can't even pay your bills or maintain anything that's going on at home. That's what made me go see about the FUROSCIX. It was something that I had to learn about, and I had to go seek from another specialist. I was excited that I was learning about something new. I just had to figure out if it was going to work, if it was going to be the best choice for her guided care plan, Once I found out that it worked for her, the first time of me giving it to her and how the amount of fluid came off, I was excited about the FUROSCIX and her using it.
FUROSCIX for me was very life-changing. Being in and out of the hospital so much and being away from my home, it caused me to have some anxiety. It was so much calmer at home. I haven't had a hospital stay in a year. That is the best thing in the world, to have more access to your home than in the hospital. I would use the FUROSCIX when it was hard to breathe. I couldn't lay flat, and if I walked and I had to stop after 3 steps, I knew the fluid was building. And you want to catch it, like the doctors explained, you want to catch it before it gets critical. So if I would have to call the doctor and say, hey, I'm feeling this, I'm feeling that, I'm not breathing well, and they would give me instruction to go ahead and use the FUROSCIX, and I would give them a call after to let them know if I was feeling better or if I was not feeling better. And most of the time, FUROSCIX made me feel better. I love it. I think it's wonderful.
What is FUROSCIX, furosemide injection, for subcutaneous use? FUROSCIX is a prescription medicine used to treat fluid buildup, which can cause congestion or swelling, also known as edema, in patients with chronic heart failure or chronic kidney disease. FUROSCIX should be replaced with oral diuretics as directed by a healthcare provider. Follow the instructions provided by your physician when taking FUROSCIX. Important safety information. Before taking FUROSCIX, read the instructions for use and tell your healthcare provider about all your medical conditions, including if you have trouble urinating, are allergic to furosemide, or any of the ingredients in FUROSCIX, or if you are allergic to medical adhesives. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. FUROSCIX and other medicines may affect each other, causing side effects or change how the medicines work. What are the possible side effects of FUROSCIX? Dehydration. FUROSCIX can cause you to lose excess water and electrolytes. Symptoms of excess water and electrolyte loss include dry mouth, increased thirst, muscle pains or cramps, decreased urine output or urine more yellow than normal, headache, dry skin, nausea, or vomiting. Your healthcare provider may check your electrolytes while receiving FUROSCIX. Low blood pressure. FUROSCIX may cause your blood pressure to decrease temporarily. You may feel lightheaded or dizzy, particularly when standing up. Getting up slowly may help. High blood sugar. If you have diabetes mellitus, FUROSCIX may increase blood glucose levels. Loss of hearing. FUROSCIX can cause ringing in your ears. Tell your healthcare provider if you have trouble hearing while taking FUROSCIX. Incomplete dosing. If you do not receive a full dose because the on-body infuser got wet, came off the skin, or there was an alarm, call your healthcare provider for more instructions. Do not apply a new on-body infuser unless instructed to do so by your healthcare provider. The most common side effects with FUROSCIX are administration site and skin reactions, such as bruising, redness, swelling, and infusion site pain. These are not all the possible side effects of FUROSCIX. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see the full prescribing information, www.furoscix.com/prescribing-information.pdf, and use instructions for use. www.furoscix.com/instructions-for-use.pdf.